Is this all new slides?
This is Nafisa Parpia. She is a naturopathic doctor. She is a practitioner at Gordon Medical Associates, where she specializes in the treatment of Lyme disease and other complex chronic diseases such as autoimmunity, mold toxicity, and environmental toxicity. She commonly uses injection techniques such as Ozone and neural therapy as adjunctive therapies in the treatment of complex chronic illnesses. Through her use of these injections, she observed the aesthetic impact they had on her patients. And it's reported that most of her patients were thrilled with the results. This led to a second specialization in aesthetic medicine. Prior to joining Gordon Medical, Nafisa was the lead Lyme disease doctor at Amitabha Medical Clinic and Healing Center. Previous to this, she worked at San Francisco Natural Medicine. Soon after she was graduated from medical school, she worked at my old client, friend, and colleague, Dietrich Klinghart's clinic, when she trained with him and one of his assistant physicians for about a year. Dr. Parpia is also a certified yoga instructor and taught vinyasa yoga for several years. She has a 7-year-old daughter who is obviously very lucky to have such a talented mom. Nafisa was invited here today to discuss ozone therapy for the treatment of wrinkles. Please welcome Dr. Nafisa Parpia.
Thank you, Dr. Schellenberger, for inviting me, and thank you for all that you do for this medicine. So on to a less serious indication for the use of ozone, but one that's made many of my patients happy: ozone therapy for the treatment of wrinkles. So I was injecting some of my chronically ill patients with ozone just for local facial lesions, local facial infections. And one thing we began to notice after a few sessions was their skin began to change. So wrinkles began to fade, and their skin began to lift. It was as if I'd injected a little bit of Botox, a little bit of hyaluronic acid. So they were so pleased with these results, they just kept coming back for more. And in fact, news traveled around the clinic with other patients, and more women wanted to come in for these treatments. I found myself practicing some aesthetic medicine when I didn't know I would be doing that. So this is what ozone therapy won't do for you. Okay. Okay. So it works best on people who've done about 8 to 10 treatments and on deeper wrinkles. So I noticed that, if you've done 3 or less, you're not going to have optimal results, and superficial wrinkles, not so much as well. So all of this is based on clinical experience. It can treat all areas of the face: forehead lines, crow's feet, the glabella, nasolabial folds. When you do that, you actually start to lift the skin, as if you've then inserted hyaluronic acid. Crow's feet as well. So we know that as we age, oxygen utilization of the cells decreases, and the NAD to NADH ratio decreases. We also know that ozone increases the NAD to NADH ratio, therefore increasing cellular oxygen utilization. Okay, so now we have increased cellular function. We've got increased vascular support. Okay. This means that now we're causing a local healing effect to the skin. And we can literally see this with our own eyes. We've got increased cell division, increased protein synthesis, cell membrane potential stability, right? And as well, ozone, it stimulates enzymes that are free radical scavengers: superoxide dismutase, catalase, peroxidase. Literally, we are seeing with our very own eyes ozone changing the skin locally. We're seeing that anti-aging effect. The difference between this and Botox and other fillers is that those are just bringing about masking of facial imperfections. This is literally changing us, right? Making our skin younger. I'm gonna go over some slides now. So this is a patient, MA. She's 44 years old. She had her forehead treated 5 times. Let me see how this pointer works here. So take a look at the line. Just, is it showing as I point? No.
It will if you put your finger on it.
Pointed at the ceiling. There's no lines on the ceiling. How about that? Okay. All right, here we go. So she has quite a deep line here, right? This was just injected 5 times with ozone, and now take a look. It's quite a dramatic difference. She was very pleased. Okay. Patient MG, she's 66 years old. We treated her frown lines, her upper and lower lip. We also treated her nasolabial folds. I want you to take a look at her frown lines. You can see that they're pretty deep, but they also go up high, right? You can see they go high up to the forehead lines. Over here, they stop right there. That's quite a difference, right? They're still a little bit deep. If she preferred to, she could have some more. I think she looks just great, but I know she wants a little bit more just to soften it, and that would work still. But you can see the difference in the length of the wrinkle. Take a look at the glabella. There's a lot going on here, right? There's a lot of lines. Over here, it's really smoothed out, okay? I want you to look at the cheeks, okay? They look fine. Now, I injected the nasal labial folds. She requested that because she wanted them to become finer. They didn't become finer, but what I noticed was that the skin tightened, okay? So you can see more definition on her face. It sags a little bit less. So as I injected the nasolabial lines, I noticed the ozone diffusing up. Hang on, let me straighten this out, up this way. And then her skin lifted. So she was another person who was very pleased and will be coming back for more. Take a look at this one. She's 62 years old. She only had 5 treatments. I injected her forehead and her crow's feet, but it looks like I've given her an eye lift. Okay. I want you to take a look at her crow's feet. Dramatic results. You see that? Before and after. I feel like we've given her 5 years more of aesthetics back. Same on the other side. This is someone who it didn't work for as well, and I think it's important to show that. Okay, her lines are fine. She's 40 years old, but take a look at some of the deeper lines. That resolved, right? You can see that deeper line gone, but the fine lines around here, they didn't go away so much. What I noticed was that it works better for deeper lines. Okay. It could be something else. It could be age-related. It could be race-related. I'm not sure. I haven't done the research on that. So let's talk a little bit about how to do it. You'll need a 5 cc syringe filled with about 4 cc's of 1% procaine, a 10 cc syringe with about 5 to 7 gamma concentration of ozone. I fill it up, 10 cc's, a 30 gauge 1/2 inch facial needle. And I like to use procaine first for a couple of reasons. I have used procaine for wrinkle therapy on its own. It does great actually, okay, because it decreases inflammation. But when I put ozone on top of that, the effects are bigger. Okay, the ozone makes the skin lift in a way that the procaine doesn't do. So that softens the wrinkles then as well. So you follow the entire length of the wrinkle with procaine neural therapy style. So literally I'm putting in a bleb across the entire wrinkle. Then I follow it with 5 to 7 gammas of ozone, and it's different. The concentration is different for different areas of the skin, and I'll speak to that in a moment as well. Now, as you inject the ozone in, you'll see it diffuse across the skin, and so you don't want to, or you don't need to keep injecting over the areas that you've seen it diffuse. If you do, you're going to see the skin puff up. Now, I noticed but that's not a bad thing. I would only do that on patients who know me very well and who trust me, okay? You don't want to start injecting a lot of ozone on someone you just met because they're going to walk away and not like you so much. The skin will puff up, particularly around the crow's feet. But I noticed that if I do that, if I put in a little bit more and they puff up, the results are more dramatic. They just have to be okay for the next 4 to 24 hours looking a little bit puffy. It's not dangerous, it's healthy. They come back looking like $1 million. it's quite a difference. But starting with the crow's feet, I wouldn't inject a lot at first, just because you don't want to scare anyone, you know. But you just, when you're on the crow's feet, just use the lowest gamma, put in a tiny bit. It still does the job really well. So typically, you want to inject about 5 to 10 points of ozone per wrinkle. Hi again. So here's the video. I had so many questions over the break, so hopefully this makes it clear. I'm starting off with, that's an ozone injection. We'll just wait until the Procaine comes in. But
what length?
I don't know if you can see. Can you see the ozone diffusing?
I thought it was a half
Okay, it's okay. There's a lot. So here I am putting the Procaine in. Okay, you can see that I'm putting in little blebs across the whole wrinkle.
What's the length of the needle?
1/2 inch. Yeah. The reason why I'm not threading it in is because I feel like that could be hard on facial skin. I haven't tried it, but I prefer to just give the blebs. It seems like it's less harsh on the skin. Now here comes the ozone. Okay, for this one, for the nasolabial folds, I need to give more ozone because the skin is tougher. Okay, so I basically thread the whole line. Okay, here are ones around the lip line. Here I come with the Procaine. Okay, and then I'm going to follow it with the ozone. The thing about doing the lips is their lips are going to look like you've injected them with hyaluronic acid for the first 24 hours. Some people really love that look, okay? Some people don't. So they need to know that's going to happen for the first 24 hours. Then the lip swelling will go down, but they're going to actually really like it. It's still going to be a little bit more plump. So you are as well plumping up the lips a little bit. And you put the ozone in. And I think now we're going to do the forehead. No.
What was the question?
If I do a lidocaine prep, I don't. Pardon me? Does it stimulate that? No, I have never seen it. And I've done a lot of lips. Haven't seen it. Yeah. I've seen the plumping up on every person. Most people really love that look after it's gone down a little bit. You know, it's a little bit too much for most people in the first 24 hours. Then it goes down, but still plumped up. Okay, so here we're doing forehead, frown lines. This is the Procaine. You know, there's always a little bit of bleeding, just little dots of blood. Sometimes there might be a little bit more bleeding because you've nicked a vessel a little bit, and it's no big deal. Just to prevent a hematoma, you just want to press down with some gauze really hard. It's a rare occurrence, but you want to warn them that it could happen. You always want to warn what the possibilities could be, but it's rare. And that's it. Okay. Thanks. Any questions or about, yeah? Oh, it's between 5 to 7 gammas. When you're on the crow's feet, you want 5 gammas. You don't want it to be higher. Okay. Okay, thank you. Right.
But you said 5 to 10 points.
For the ozone. So
Why can't you just infiltrate it the same way as you just did with the...
because the ozone starts to diffuse, and I don't need to.